In ancient Greece, the society was composed of free men and slaves. A doctor could have trainees who belonged to either group, and after training, they were also called doctors. These doctors treated patients differently according to their societal status. Slave doctors mainly treated slaves, and they would never explain the details of the treatment. Free doctors, on the other hand, mainly treated free patients, explained to them the nature of their illness, and prescribed medicine, only after obtaining their consent. One interesting example of this topic involves Alexander the Great. While invading Asia, he endured almost fatal disease. Because of the severity of the disease, but also his own nature and temperament, no doctor dared to treat him. Finally, under strong pressure from the emperor, a high-ranked military physician treated him, but only after Alexander declared in public his trust in that physician. My name is Branka Bernard, and I'm CEO of Fabula Movens, a company focusing on innovations in education. Have you guessed the topic of today's lecture? It is informed consent. Let us see how it works in today's healthcare and research setting. Before performing any invasive test or providing medical treatment, healthcare workers must obtain permission from a patient in a manner that is informed and voluntary. The principle of informed and free decision is also valid for any kind of research. According to the European Commission directive, informed consent is the decision which must be written, dated, and signed to take part in a clinical trial, taken freely after being informed of its nature, significance, implications, and risk. All of that needs to be appropriately documented by any person capable of giving consent. If the person is not capable of giving consent, their legal representative will do that in his place. If the person concerned is unable to write, oral consent in the presence of at least one witness may be given in exceptional cases as provided for in national legislation. This means that people have the right to information about risks, benefits, and alternative treatments when making decisions about their medical care, and have the freedom to choose. Valid consent is freely given, specific, informed, and unambiguous. The patient must be competent to understand and decide, receive a full disclosure, and comprehend this disclosure. Act voluntarily. Consent to proposed actions. Language must be plain and understandable to the patient. It should include asking open-ended questions. Do you understand the benefits and risks? What are the benefits and risks? Several exceptions to the requirement for informed consent include if the patient is incapacitated, life-threatening emergencies with inadequate time to obtain consent, and voluntary waived consent. Children cannot provide informed consent. As such, parents must permit treatments or interventions. In this case, it is not called informed consent, but informed permission. In emergencies, if there is a lack of decision-making capacity, there is an exception, with the privilege to give emergency medical care without the patient's consent. This privilege is based on the theory of implied consent. The law assumes that an unconscious patient would consent to emergency care if the patients were conscious and able to consent. This is reasonable man standard. That is, the law assumes that a reasonable person would want medical care in an emergency. Another important terminology to mention is shared decision-making, which includes both physicians' knowledge and patients' preferences. Healthcare providers have been urged to integrate patients more actively as partners in their medical decisions. This patient's involvement is considered as shared decision-making, where both patient and provider contribute to the decision. Although the majority of patients wish to participate in decisions, there is always a subset of patients who wanted to delegate decisions. Patients who have just received a serious diagnosis and feel vulnerable may not want the responsibility of being involved in decision-making. For example, in order to cope with their cancer diagnosis, some patients may not want the information about their cancer that would be necessary for participation in decision making. In some situations, doctors lack time to properly practice the shared decision-making process. And sometimes patients are confused about what constitutes appropriate patient participation, even if they have been given a choice. Along with the right to informed consent, there is also the right of informed refusal. People who have legal and clinical capacity may refuse any medical care, even if it's something almost everyone else would accept or something that is clearly life-saving. For example, a person having a heart attack can decide to leave the hospital even if that may lead to death. Even if other people think the decision is wrong or irrational, the decision to refuse treatment cannot be used by itself as a proof that the person is incapacitated. In many cases, people refuse treatment based on fear, misunderstanding, lack of trust, or psychological illness. Patients who refuse treatment for certain infectious diseases sometimes put other people at risk. Also, people who refuse to allow the treatment of others, such as a minor child or dependent adult, may place other persons' health at risk. We can therefore conclude that the capacity to participate or make healthcare decisions is today regarded as highly valuable and is protected by the law. Let us all work together toward a well-informed and educated society to ensure the greatest benefit of this important human right, the informed consent.